Oh, that's very good, isn't it?
Yeah.
And then straight back to the GP or the consultant, I was worried.
They can come from outpatients clinic straight up and back down with the results, so yeah.
Oh, good.
So one-stop clinic there.
Look at the size of the kit we used to use in Cardiff, say 10 years ago.
It's huge, is it?
It was massive. And it was always going wrong. You were always having to calibrate it, and this is
First class.
It's a lot more
very simple.
Yeah.
Good.
Allows you to just look at the screen instead of where the test is going.
Yeah.
two strands of cardiology.
Yeah.
Just back on
Good patient outcomes then as a result of it.
Could have the pictures on the room and food.
Isn't this comfortable with embedded in it, isn't it?
Yes, it is nice and
Nice and
bright.
manageable for
Yes.
That's the good.
We've got to work out with the consultants in Morgannwg and how we're going to manage it. The next big meeting is
This new unit houses all of the non-invasive cardiac diagnostic tests, and I say it'll facilitate speeding up the inpatient merger, which first of all brought Swansea and Morgannwg together, and we now have the new local health board, that there are going to be significant patient benefits coming out of all of this. It means too that we've got a better service for those brought in as emergencies, can be seen much quicker, and we believe too that GPs will get a better service out of it all, that there'll potential for a 24-hour turnaround, and the patient can have his appointment, be reviewed in the clinic, and with a bit of luck they can either move on and out or move in for treatment. So it's a really big and positive change for
It's absolutely beautiful here in terms of the facilities, and of course how that's going to help with patient care. And I have to say, going round, when you see the equipment, these tiny bits of equipment that cost tens and tens of thousands of pounds, and you realise, you know, this wasn't around 20 years ago, 10 years ago, and medicine's just moving so quickly in terms of how we can diagnose things, how we can keep people alive longer, and we can really make a difference. So budgets find it, I think, very hard to keep up with the developments in medicine, and I'm always very grateful when something does come in on time and on budget, and that we are seen to make money go a long way in terms of patient care. But I must say I was very impressed when I went around and saw the wards, and the size of the operation here, the sisters in control, was really quite large in terms of the patients and the bed occupancies. And you recognise then, you know, we are starting to identify patients via GPs much sooner. And it was nice as well to see a GP here as well, to show the excellent working, I think, between primary and secondary care in this area. But I think, you see, the more we do, the more we'll be expanding. And the more people will be saving, changing their lives and everything. And I think that's very important. But I've also been impressed when I'm going around talking about the links with Morriston and the very fruitful discussions that are going on, that we're recognising now it is one unit, one LHB, and that we can utilise the services appropriately on both sites. And we've also been talking about how people can be here quickly to Morriston, quickly dealt with, and quickly back here, which I think is excellent for patients, so they can be back in their locality amongst family and friends so quickly after they've had their operation and everything. So I think this is absolutely first-class news. I have to say, you know, it's a lovely hospital to visit. I declare open.
Thank you.